Hello, my name is Tristan Yarbrough and I am a Mercy Health infection preventionist. Welcome to Mercy Health. Although my job title is infection preventionist, all of us are responsible for infection prevention. It is a requirement here at Mercy Health that we all do the right thing to prevent infections. Hand hygiene is the single most important thing you can do to prevent infections in the healthcare facility. Most of the time, hand hygiene can be performed with alcohol hand sanitizer. The following are times when soap and water must be used: when hands are visibly soiled, when you have had hand-glove contact with blood or body fluid, prior to eating, after using the restroom, and after caring for a patient with a C. diff infection. When using soap and water, make sure that you use 15 to 20 seconds with water, soap, and friction. In the video, you heard about standard precautions and personal protective equipment. Personal protective equipment, also known as PPE, consists of items used by staff to create barriers to protect them from a potential blood or body exposure. Since it is impossible to tell if a patient is infected with a bloodborne pathogen, all patients should be treated as if they are potentially infected with a bloodborne pathogen. PPE items that may be used include gown, mask, or respirator. Fit testing should occur each year in order to wear an N95 respirator. If you are unable to wear a respirator, for instance a male with a lot of facial hair, you must wear a PAPR. Goggles or face shield, gloves, and of course hand hygiene, which should be performed for 15 seconds with soap or water or using alcohol hand sanitizer until your hands are dry. Standard precautions also include safe handling of dirty equipment and linen, keeping the environmental surfaces clean, safe sharps handling, safe resuscitation, patient placement, respiratory and cough hygiene. And just remember, we use this on all patients all of the time. It is our standard of care. Next, we will speak on the specific steps of donning PPE. First, put on a gown. Fully cover your torso from neck to knees, arms to end of wrist, and wrap around the back. Fasten in the back of neck and at the waist. Next, using a mask or respirator, secure ties or elastic bands at middle of head and neck. Fit flexible band to nose bridge. Fit snug to face and below chin. Fit check your respirator. Then, using goggles or a face shield, place over face and eyes and adjust to fit. Lastly, when using gloves, extend to cover wrist of isolation gown. Next, I will speak on how to safely remove personal protective equipment. First, you remove your gloves. Outside of gloves are contaminated. If your hands get contaminated during glove removal, immediately wash your hands or use an alcohol-based hand sanitizer. Using a gloved hand, grasp the palm area of the other gloved hand and peel off first glove. Hold removed glove in gloved hand. Slide fingers of ungloved hand under remaining glove at wrist and peel off second glove over first glove. Discard gloves in a waste container. Next, we will remove goggles or face shield. Outside of goggles or face shield are contaminated. If your hands get contaminated during goggle or face shield removal, immediately wash your hands or use an alcohol-based hand sanitizer. Remove goggles or face shield from the back by lifting headband or earpieces. If the item is reusable, place in designated receptacle for reprocessing. Otherwise, discard in a waste container. Next, you remove your gown. Gown front and sleeves are contaminated. If your hands get contaminated during gown removal, immediately wash your hands or use an alcohol-based hand sanitizer. Unfasten gown ties, taking care that sleeves don't contact your body when reaching for ties. Pull gown away from neck and shoulders, touching inside of gown only. Turn gown inside out. Next, fold or roll into a bundle and discard in a waste container. Next, when removing your mask or respirator, remember that the front of your mask or respirator is contaminated. Do not touch this. If your hands get contaminated during mask or respirator removal, immediately wash your hands or use an alcohol-based hand sanitizer. Grasp bottom ties or elastic of the mask or respirator and then the ones at the top and remove without touching the front. Discard in a waste container. Remember to wash your hands or use an alcohol-based hand sanitizer immediately after removing all PPE. Next, I will cover a second approved method of removing personal protective equipment. First, you remove your gown and gloves. Gown front and sleeves and the outside of gloves are contaminated. If your hands get contaminated during gown or glove removal, immediately wash your hands or use an alcohol-based hand sanitizer. Grasp the gown in the front and pull away from your body so that the ties break, touching outside of gown only with gloved hands. While removing the gown, fold or roll the gown inside out into a bundle. As you are removing the gown, peel off your gloves at the same time, only touching the inside of the gloves and gown with your bare hands. Place the gown and gloves into a waste container. Goggles or face shield. Outside of goggles or face shield are contaminated. If your hands get contaminated during goggle or face shield removal, immediately wash your hands or use an alcohol-based hand sanitizer. Remove goggles or face shield from the back by lifting headband and without touching the front of the goggles or face shield. If the item is reusable, place in designated receptacle for reprocessing. Otherwise, discard in a waste container. Removing mask or respirator. Front of mask or respirator is contaminated. Do not touch. If your hands get contaminated during mask or respirator removal, immediately wash your hands or use an alcohol-based hand sanitizer. Grasp bottom ties or elastics of the mask or respirator, then the ones at the top, and remove without touching the front. Discard in a waste container. Remember to always wash hands or use an alcohol-based hand sanitizer immediately after removing all PPE. Next, we will cover transmission-based precautions. If a patient is in transmission precautions, staff should do what the precaution sign directs to do. With airborne precautions, make sure the patient is in a negative pressure room with the door closed. When entering the room of a patient in airborne precautions, make sure that you perform the appropriate hand hygiene. This is either with alcohol hand sanitizer or soap and water. Also, before entering the room, make sure that you use the appropriate N95 fitted respirator or a PAPR. When transporting a patient in airborne precautions, please be sure that they are wearing a surgical mask. Essential transport only for patients in airborne precautions. Make sure that you alert the receiving department regarding the patient's isolation precaution status. Clean and disinfect transport vehicle. For example, common conditions that may require a patient to be in airborne precautions include pulmonary TB or chickenpox. For patients in droplet precautions, please make sure that you wear a mask upon entering the room. For flu, an N95 or PAPR is recommended for aerosol generating procedures. If contact with secretions is likely, use an eye cover as well as a gown and gloves. When transporting patients who are in droplet precautions, please be sure that they use a surgical mask. common conditions which may require a patient to be in droplet precautions include influenza, also known as flu, meningitis, and pertussis. For patients in contact precautions, please be sure to use the appropriate hand hygiene before entering the room. Upon entering the room, make sure that you are wearing a gown and gloves. When transporting a patient in contact precautions, please be sure to alert the receiving department regarding the patient's isolation precaution status. Linens should not be soiled and dressings should be clean and dry. If patient is in a wheelchair, drape a clean sheet over patient and side rails. If patient is going in their own bed, drape a clean sheet over patient and side rails. Use a disinfecting cloth on head and footboards where hands will touch to push and pull the bed. Remove gloves and wash hands before leaving room. After transport, decontaminate side rails by using a disinfecting cloth. Common conditions that may require a patient to be in contact precautions include multi-drug resistant organisms such as MRSA, VRE, ESBLs, and carbapenem-resistant gram-negative rods, scabies and lice, or wounds or abscesses with uncontained drainage. Contact Plus precautions are for patients with suspected or confirmed C. diff diarrhea. It is very important to remember to always use soap and water on leaving the room. Hand sanitizer is not efficient in killing C. diff spores. Upon entering the room, please remember to perform the appropriate hand hygiene. Also remember to always wear a gown and gloves. When transporting patients in Contact Plus precautions, remember to alert the receiving department regarding the patient's isolation precaution status. Linens should not be soiled and dressings should be clean and dry. If the patient is in a wheelchair, drape a clean sheet over the patient and side rails. If patient is going in their own bed, drape a clean sheet over patient and side rails. Use a bleach disinfecting cloth on head and footboards where hands will touch to push or pull the bed. Remove gloves and wash hands before leaving room. After transport, decontaminate side rails by using a bleach disinfecting cloth. For all patients in transmission-based precautions, please remember to clean high-touch areas several times a day. If a patient is in Contact Plus precautions, please remember that using a product with bleach is necessary to kill C. diff spores. An exposure incident is an unprotected exposure to blood or body fluid or an unprotected exposure to a communicable disease. An exposure incident can consist of contaminated Sharps injuries, splashes of blood or body fluid onto mucous membranes or non-intact skin, or human bites. The Mercy process for an accidental blood or body fluid exposure to unprotected mucous membranes or non-intact skin is as follows. Immediately clean, flush, or wash area of exposure. Cover any wounds. Call BBP hotline. Communicate incident to immediate supervisor and do handoff communication prior to going for treatment. Treatment per direction of employee health nurse, labs or evaluation, including future follow-up. Complete Safe Care Incident Report for tracking and trending. Another topic to discuss is bed bugs. Bed bugs do not transmit disease and are an environmental issue. They do not fly or hop, but they are very expedient crawling bugs. Bed bugs sometimes get brought into healthcare facilities as hitchhikers on patients or belongings of patients and visitors. Patients who state that there are bed bugs in the home, have insect bites, or physical evidence of bed bugs present will be assessed further to determine if bed bugs are present. Subsequent actions are taken to provide a safe, clean environment for all patients by preventing infestation or spread of bed bugs in the hospital setting. Assess room and, with verbal consent, patient belongings for physical evidence of bed bugs. Please refer to Guidelines for Bed Bugs in Acute Care Facility available in Compliance 360. Here is a list of your site-based infection preventionists. At Anderson, Amy Fortin. Claremont, Mary Barnett. Fairfield, Ellen Hensler. Jewish, Tristan Yarbrough. West, Denise Moore. And the Regional Infection Prevention Manager, who is based at Fairfield, Jan Miller. I know that was a lot of information to absorb. Your site infection preventionist is a great resource for any questions you may have. Thank you for choosing Mercy. Welcome to our team.